In this round of clinical cases in equine reproduction, we're going to discuss a case of bacterial endometritis. Hopefully all of you will have downloaded the free ebook, Clinical Cases in Equine Reproduction, available through the Apple Store and available to download on Apple devices. The history on this particular mare is that she's a 17-year-old quarter horse mare, and she was presented in mid-February for routine breeding management. The owner had reported that she had several foals previously, and the mare was left open intentionally after a late foaling the previous year. It was noted that the mare had been housed under lights since early December. In our initial ultrasound exam, the mare was noted to be in diestrus. There was a small corpus luteum visible on one ovary, and there was no edema in the uterus and no free fluid in the uterine lumen, as noted in the upper right photograph with the cross-section of the uterus up here, urinary bladder down below. The mare was consequently administered prostaglandins. We generally use Estromate, 1 mil, 250 micrograms as an intramuscular injection. And as routine, we ultrasounded the mare 4 days later. She did have a developing follicle. It was 32 millimeters in diameter. There was uterine edema present, but somewhat unexpectedly, she had a moderate volume of echogenic fluid inside her uterine lumen. Because of that, we decided to take a swab sample for culture and a brush sample for cytology. The swab, double-guarded swab, is shown in the upper photograph. Here in a cadaver specimen, and in the lower photograph, we can see the brush that we use for cytology. Again, it is also double-guarded. Once we collected the swab sample, we plated it on a series of augers, TSA with 5% sheep's blood, also on McConkey auger, and both gram-positive and gram-negative chromogenic auger. The cytology sample was rolled out onto a pair of glass slides and stained with a Diff-Quick stain. The results of uterine culture on the TSA blood auger: there were small white colonies with beta hemolysis visible around them. No growth on McConkey auger. Gram-positive chromogenic auger, there were small light blue colonies. And on gram-negative chromogenic auger, there was no growth. So interpretation of the culture results on this mare was Streptococcus equi subspecies Zoepidemicus. Uterine cytology: there was a large number of white blood cells visible on the cytology, and virtually every high-powered field had multiple white blood cells visible, as seen in the upper photograph, along with some normal uterine epithelial cells. And in some high-powered fields, we could see chains of cocci here. So our interpretation on the cytology was, number one, severe inflammation, and number two, that we could actually see chains of cocci that is indicative of Streptococcus. So our overall clinical diagnosis was infectious endometritis due to Strep equi subspecies Zoepidemicus, and our initial therapy consisted that day of uterine lavage, 3 liters of lactated ringers. A bag was suspended up above the mare, some Y tubing here, a silastic catheter with a balloon cuff was placed up into her uterus. A liter was run in by gravity flow and then drained out, then a second liter, then a third liter, and the idea is to flush the mare until the effluent fluid is clear, of which it happened of 3 liters was sufficient for that mare on that day. That was followed after the lavage by an intrauterine infusion of antibiotics. We chose Ceftiofur Naxel on this particular mare on this day, and it was 1 gram diluted in 20 mils of sterile water, and we repeated that once a day for 3 consecutive days. 2 days later, the ultrasound exam showed a 37 millimeter follicle with moderate uterine edema, follicle seen up here on the upper ultrasound exam, and this moderate uterine edema down on the lower right ultrasound photograph. We contacted the stallion station, and that day was a collection day. We ordered semen and asked for FedEx delivery by an overnight courier. And then once we got the confirmation that they had collected, we did have a dose coming to us. We went out and gave deslorelin to the mare. The following morning, the mare still had her follicle. We lavaged out her uterus first thing in the morning, gave her a dose of the antibiotic Exceed, 6.6 milligrams per kilogram as an intramuscular injection. The FedEx delivery person arrived at 11 o'clock in the morning. We had a single dose of semen. The total and progressive sperm motility was 70% and 58% respectively. The mare was inseminated, and later that day, a uterine lavage was performed and oxytocin was administered. The following morning, ultrasound exam confirmed that the mare had indeed ovulated. There was only a trace amount of slightly echogenic fluid present in the uterine lumen, so we decided to only give oxytocin, and it was 20 units in the muscle approximately every 6 hours. 4 doses total were given over that day. And an ultrasound exam 14 days later confirmed that the mare was pregnant. A general review of bacterial endometritis is that it's one of the most common uterine problems of brood mares and certainly can result in decreased fertility in mares. And an accurate diagnosis is important for optimal treatment. And there's no one diagnostic test that's capable of detecting all cases of infectious endometritis, whether that's culture or cytology. And then therapy should be based on antimicrobial susceptibility test results whenever possible. Predisposing factors for bacterial endometritis in mares, one of which is poor perineal conformation, as suggested by the upper photograph, poor tone to the vulva, as indicated by the photograph below, abnormal cervical anatomy or function, decreased uterine clearance, trauma to the reproductive tract, poor breeding hygiene, whether that's live cover or by insemination, and other factors. Diagnosis in general of bacterial endometritis can be suggested by ultrasonography, as in this case, with the presence, number one, of fluid in the uterus, number two, the echogenic character of that fluid. Any fluid in a diestrous mare, a mare with a corpus luteum and elevated levels of progesterone, any diestrous mare with fluid in the uterus is strongly suggestive of endometritis. Speculum exam, if you choose to do one, the upper right photograph, you may see a reddened cervix or a discharge coming out of the cervix. Certainly, the most common way to diagnose endometritis is by uterine culture with a guarded swab, or a low volume lavage can be performed. A uterine cytology can be indicative of the presence of inflammation. A biopsy can reveal endometritis based on histopathology or on culture or cytology of a biopsy, or samples can be collected for PCR looking for the DNA footprint of bacterial or fungal organisms. In order to collect samples for culture and cytology, the materials that we need would be some type of a guarded swab. In this case, it's a double guarded swab. Cytology, very similar. In this case, we use a brush. Transport tube, once we get our culture collected, we're going to put the sample in a transport tube and take it to the microbiology laboratory. A pair of glass slides. We generally write on the glass slide with a pencil so that the ink from a pen or Sharpie doesn't run after samples collected. And then a sterile sleeve and a obstetrical lubricant. The collection of the samples, we're going to start with the culture swab. Make sure the mare knows you're ready. And got the tail wrap. The perineum has been thoroughly washed. Going to place the culture device in the palm of your hand. Start going up inside the reproductive tract with some obstetrical lube on the back of the sterile sleeve. Find the cervix. Gently pass the culture instrument through the cervix up into the uterus. Then advance the middle guard. And then slowly, one would then roll or rotate the inner swab up against the endometrium. And so hopefully you're going to pick up some cells, mucus, debris, bacteria, if there's any present. and that should be in contact with the endometrium for somewhere 10 to 15 seconds or so. At the end of that time, we'll pull back on the inner swab in the middle guard, pull the swab out. We're going to leave the outer and middle guard in there. Going to pass the swab sample down into the transport tube, snip it off, place the cap on. And while leaving the outer guard and middle guard in, we're just going to take the cytology brush, go back up in. So essentially we only go up in the mare once. You can choose to go up twice, it doesn't really matter. And then again with this, we're going to make contact with the endometrium gently and rotate that brush for a period of, again, somewhere 10 seconds or longer, trying to pick up cellular material, mucus debris, etc. And then that will be withdrawn just like the first round. And at that point, we're done. Everything can come out. We'll walk back over to where our glass slides are. The guards can be thrown away, sleeve can be thrown away. We're going to snap off the upper part of the brush sample and then roll the brush along the glass slides a couple times each, rolling out any of the material that the brush has picked up within the uterus. Again, the slides are pre-labeled with the mare's name and the collection date, again in pencil. If you think the mare has a uterine infection and your samples for standard culture and standard cytology do not detect the presence of an organism or do not detect the presence of inflammation, but you think there is going to be some, a low volume lavage should be considered. A lot of ways to do this. We'll infuse anywhere from 150 to 250 mils of sterile saline or sterile lactated ringers. Pass that up into the mare's uterus, clamp it off, let that sit for a couple minutes, do transrectal massage of the uterus, maybe administer oxytocin to help with fluid recovery. Lower the bag, open up the outflow port through this single line tubing, and try to catch as much of the effluent fluid out as possible down back into the original bag. That bag will then, the contents of the bag will then be placed into some 50 mil conical tubes, and those tubes will be centrifuged for about 10 minutes at 600 times G, and we will use the pellet for culture and cytology and possibly for PCR. Very helpful in mares that are culture negative using a standard technique, but you think that there's an organism, and this certainly can be a way to detect that. The fluid will essentially sample the entire inside lumen of the uterus, both horns and the uterine body, and if there are organisms up in there, this is more likely to detect them. Plating out the culture swab, we are currently using a quad plate, a single plate that has 4 different types of microbial agar on it. We're going to take our sample that we've just collected from the mare, plate this out on all 4 quadrants. That's the gram-positive chromogenic agar, now the gram-negative chromogenic agar. Rolling the slide, rolling the swab, a conky agar, and finally the TSA agar with sheep's blood. We're done with the swab. We are going to save that for further testing if needed. And then with some other sterile loops, we're going to put a secondary streak on each quadrant. Blood agar, secondary streak to spread out the colonies. You can use these independent loops, or you can have a wire loop that you flame sterilize. Gram-positive chromogenic agar, and do the same thing with the gram-negative chromogenic agar and the McConkey agar, so that all 4 of them have secondary streaks. Again, the idea is to spread out the colonies for individual identification and then further use in antimicrobial susceptibility testing should you choose to do that. That goes in an incubator that would be labeled and evaluated at 24, 48, and 72 hours. Now, the organisms, the most common four that we see, number one is Strep zoepidemicus, and as we can see on the quad plate on the left, it's light blue colonies on gram-positive chromogenic auger, no growth on gram-negative chromogenic auger, tiny white colonies with beta hemolysis on TSA with sheep's blood, and no growth on MacConkey. E. coli, no growth on gram-positive, pink colonies on the gram-negative chromogenic auger. MacConkey auger has pink colonies, and there are small white colonies on sheep's blood. Very easy to identify the difference between the two most common organisms, Strep zoepidemicus and E. coli, using these quad plates. Moving on to Pseudomonas and Klebsiella. Pseudomonas, no growth on gram-positive chromogenic auger, greenish colonies growing on the gram-negative. Colonies also grow on MacConkeys, and these somewhat mucoid colonies growing here on the TSA auger. Klebsiella, no growth on gram-positive chromogenic auger, these somewhat dark blue colonies on gram-negative chromogenic auger, pink colonies on MacConkey, and these white colonies on sheep's blood. All four very distinctively different growth characteristics on these quad plates. We do antimicrobial susceptibility testing on virtually every organism that we culture out, and in that way we can keep track of the various organisms and their susceptibility patterns, and it allows us to choose an antibiotic that has the most susceptibility to that particular organism. Cytology, generally we're looking for the presence of white blood cells. In this one there's also some red blood cells and a raft of normal uterine epithelial cells. Occasionally, like the case that we have discussed currently, we can actually see bacterial organisms present. In this case, chains of cocci. In this particular, a different mare with bacterial endometritis, she happened to have E. coli as a bacterial agent, and these are rod-shaped bacteria. This is on Diffquick, it's not a gram stain, and there's a fair amount of debris in the background as well that's important to note. As we interpret our endometrial cytology, we use a very common grading scale. I think it's important that all clinics and all people have a scale, a relative scale that's helpful for them. This is a relatively common one used in equine practice. If there are no white blood cells per high-powered field visible, the interpretation would be no inflammation, 1 to 2 white blood cells per high-powered field. Mild inflammation, 3 to 5 is moderate, and greater than 5 is severe inflammation. And this works well for cytology samples collected on a swab or on a brush. It has to be adjusted a bit for the interpretation of the cytology from a low-volume lavage. Bacteria that we culture in our world, looking at over 600 uterine cultures, 73% of the positive cultures were Streptococcus. Probably about 18 to 20% of mares that we culture do have a bacterial organism cultured. 34% had E. coli, 5% Klebsiella, 4% Pseudomonas, and about 1% had staph. Now, the numbers obviously add up to more than 100% because some mares have more than one organism. It's not that unusual to have Streptococcus and E. coli cultured from the same mares, or strep with Klebsiella cultured from the same individual mare. The general treatment for bacterial endometritis, correct the predisposing factors, of course. Uterine lavage should get rid of as much of the organism as possible. Inflammatory debris, inflammatory cells, an ecbolic agent such as oxytocin or possibly prostaglandins can be used along with uterine lavage. Intrauterine antibiotics are commonly used. We'll discuss that more in a moment. Systemic antibiotics, some people choose in individual cases to use a systemic antibiotic. And other treatments may include Tris EDTA, the DMSO, hydrogen peroxide, and maybe some other non-antibiotic agents, often in a treatment for the potential for biofilm. and then a mare may need a Caslick. Intrauterine medications that have been commonly administered to horses in alphabetical order here. Amikacin is 1 to 2 grams, and that needs to be buffered because of the acidity of the amikacin. Ampicillin, ceftiofur, enrofloxacin, brand name Bacterial should never be put up in the equine uterus. It's highly inflammatory, but there's a water-soluble version of enrofloxacin. Should that be the best agent based on antimicrobial susceptibility testing, that certainly can be put up in the uterus. Gentamicin, again, very acidic, 1 gram, maybe 2 grams, and that should be buffered with sodium bicarbonate. Penicillin, and then, depending on availability, timentin. Occasionally, mares are given systemic antibiotics to treat a uterine infection, endometritis. A couple of the possibilities are the long-acting ceftiofur product, Exceed, enrofloxacin, again, not to be put up in the uterus, but given systemically, typically for resistant organisms such as Pseudomonas, and then potential other options, trimethoprim with some type of sulfonamide like sulfamethoxazole, penicillin, procaine or potassium penicillin, and gentamicin. In our world, it's a little less common to give a systemic antibiotic for bacterial endometritis in mares. You can find the doses and routes and frequency of systemic antibiotics in many formularies. But again, here with Exceed and Bacterial, gentamicin, procaine, penicillin, trimethoprim, sulfamethoxazole, and trimethoprim sulfadiazine, the doses and routes and frequency are here. There are bacterial endometritis cases that are either difficult to treat or recurring. And it could be that there's still a nidus of infection that is still remaining in the mare, maybe associated with a biofilm up within the uterus. Could be that the vestibule is the nidus for reinfection, or the clitoral fossa, clitoral sinuses. There is a possibility also of a dormant infection of bacteria like Strep zoepidemicus located deep within the endometrial tissue, and it's possible that that infection may become activated and lead to a recurrent or persistent infection. Some mares have anatomical issues that need to be identified and corrected if possible. That could be with the perineal area, the vestibulovaginal seal, or potentially a cervical injury or defect. And also, breeding hygiene should be evaluated in these cases. Take-home messages for bacterial endometritis is that mares can have a uterine infection without overt clinical signs, as in no vaginal discharge, no free fluid in the uterus, and yet still have an infection present. Always be thorough with your diagnostic tests and your therapeutic protocols. In general, a combination of uterine cytology and uterine culture is recommended to optimize the diagnostic accuracy to get the correct diagnosis. If your samples for cytology and culture using a swab and brush do not indicate the presence of an infection, but you are concerned that there is actually an infection present, consider a low-volume lavage. Always base your treatments on the results of antimicrobial susceptibility tests, and that's especially important for gram-negative organisms, and try to adhere to the principles of antibiotic stewardship whenever you're treating a mare. If you have any additional questions or want additional information, you can look at the website for the Equine Reproduction Laboratory at Colorado State University, or contact us by email, phone. We're also on Facebook and Instagram.